Thank you. Everybody has been here for a few hours, so मेरे पास दो options हैं. Either I say the famous words "lunch is served" and end it, or I say a few words which I have been thinking about. So I'll take just a few minutes of your time. First of all, I think big round of applause for Mr. Farhan Anis and Dr. Khalid Nizam for organizing this. This is 2 decades, 20 years, so it's a big achievement. And another huge round of applause for the sponsors, such as Morgan, Neon, Pharmagen, Nimbus, Goodyear, Business Links, and Shabir Enterprises International, and Aerochem, because without them, of course, this wouldn't have been possible. So special thanks to them. So there have been some intriguing sessions that have been conducted now and will be conducted in the time to come. Of course, the challenges to the industry are worldwide now. This is not an easy industry to work in any part of the world, including Pakistan. And the discussions that happen, for example, on digitalization and so on, are obviously always helpful. But I think I had 2 comments to add to the discussion of the digitalization and the very excellent presentation that was given earlier. Is one that help digitalization can give in assessing whether a product is genuine or not, the counterfeiting part. And the second part, I think one has to be careful about digitalization is the non-human aspect of it. Because eventually, as the world is becoming a digital world, the interaction between human beings to human being is deteriorating, and we are reaching a stage where I would refer to, because we are mostly locals here, the UBL ka ad hai. क्या मैं एक नंबर तो नहीं हूँ, तो the digitalization जो thing है, the problem with digitalization is that are we all going to become, everything is going to become a number, and that takes out the human aspect from it. And I think that's the part which has to be balanced. Just like, for example, in schools with the digitalization, students are not reading books as much, they're not interacting with each other as much, group dynamics are being affected. So one has to be careful that as we take this digital line, which everyone has to, the technology is there, you have to adopt it, there's no way around it. You have to balance it out with the human part, human aspect of it. And this has been there before also. There have been studies in human factors or ergonomics and so on, which are all linked to the use of technology in one way or the other. The problem in Pakistan also has been in this sector is that it has never really been identified as a priority sector by the government. And by the government, I mean across all platforms, not just the cabinet, not just DRAP, not just the Ministry of Commerce, not just the Board of Investment, not just the Ministry of Health, but across all sectors, across all platforms of the government, this must be identified as a priority sector. They have identified pharmaceutical as a priority sector in the last few months, I would say. But again, this happens, a phase comes, they identify it as a very critical sector, and then the phase passes, and we are in a new era where they again forget about pharmaceuticals. So I think the reason I point this out is the COVID-19 pandemic. I think during the COVID-19 pandemic, the pharmaceutical industry and the healthcare sector as a whole did an amazing job providing healthcare facilities, providing medicines in spite of shutdowns across the world, of supply chains, and so on. But I don't think the government at any level really appreciated what the healthcare sector did during COVID-19 or the pharmaceutical sector did during COVID-19 pandemic. It's not that they need to give out gifts or something, but some appreciation at any level, be it the cabinet, be it the parliament, must be there to encourage this, because on one side, whenever something like this happens, God forbid a pandemic comes, an earthquake or floods or anything like that, a natural calamity or a disaster comes, or a health pandemic, everyone is geared up to, in Pakistan, to say, okay, the pharmaceutical industry and the healthcare sector must do something. And when they do something, nobody really acknowledges anything, and nobody really appreciates what they do. And then, unfortunately, the next time around comes, and everyone is expecting the same. So I think that's where also the human part, as I was saying earlier, is lacking. What the government needs to do, I think, and what we as part of the industry need to do is, we need to make realistic choices and realistic decisions. China as an example, or India as an example in the pharmaceutical industry, I mean, what they have done, I mean, it's not easy to replicate, but we should make realistic choices and realistic decisions. So the government has to incentivize the industry, whether it's harmonization of taxation, whether it is harmonization of policies at the state and the provincial level, whether it is at training facilities, because as we go down this road of digitalization and new technologies in the industry, you need training for that also. And at the same time, we as the industry have to gear up to understand that we are lagging behind the world in this industry, like in certain other industries also. But since, as has been pointed out in the previous discussions also, this is a very highly regulated industry. So the government is always in a hurry to adopt the best practices or the highest global standards, and they don't look at the practical situation that what is the financial circumstances of this country and whether the industry can actually, and the hospitals, the industry, the healthcare sector as a whole actually, and the pharmaceutical industry can actually catch up with the world. It's very easy to make a policy on paper. I mean, 90% of the time, unfortunately, in Pakistan and in many countries, people are just borrowing what the other country has done. They just change a few words and the policy is there, done and dusted and launched to take the country to the next level. It doesn't really happen that way. You have to take a realistic approach and look at realistically what can be done, what is achievable. Otherwise, just printing paper after paper, or in a digital world, just, you know, emailing or WhatsApping paper after paper will not really solve anything. I think it's the same situation with digitalization, as was mentioned, that a lot of data is out there, and especially during the COVID pandemic, a lot of data sharing was done. WhatsApp is an example, I think. Probably, I think a safe estimate would be that 90% of our information shared is not really necessary, but it is shared because it's easy to share. So same thing in this sector, in this industry also. 90% of the things I think the government is doing and we are forced to do are not really benefiting the industry. You need to have a focused and a realistic decision making. You have to have the willpower to make the right decisions at the right time. Otherwise, you will keep on lagging behind the world, as we unfortunately are. So I think we must aim as a whole, with the government support and making realistic and practical decisions, to identify Pakistan as a hub for quality generic manufacturing by way of formulation, because that's our strength right now. Adding on to the APS sector later on as the time proceeds. It's not an overnight change that can happen. I would just like to share a couple of numbers before I end. The Pharmaceutical report of India of 2022-23 lists 2,296 companies registered in India who are manufacturing either allopathic, API, nutraceutical, food supplements, and so on. And out of these, 1809, which is 80%, are designated as small-scale manufacturing industries. So large-scale manufacturing industries in this sector in India are only 220 out of 2296. Now here the government is, and certain people are saying that, you know, let's just go big, just go big. It's not that you need to go big, it's that you need to capture your niche market. You don't have to be a huge player in every market. You need to identify your niche and you have to work on that. I would give the example of the Moderna vaccine. It wasn't a big company. They were just working on one product, and that one product made them a big company. So I think this is happening more in the world. The innovative products are not coming from the large, big giants. They are coming from the small, focused groups or focused companies. I think that's the approach in Pakistan we need to look at also, that instead of just looking at scale, we should look at the value addition that you can do in the level, in the scale that you are working. So thank you very much for this opportunity. Once again, it's good to see 20 years since this Pharma Asia started, and it's a big achievement, and I hope and pray that this goes better and bigger in the years to come, and people here can learn from whatever is shared here, and thank you very much.